Yes, hi, this is Dr. Ann Lake, and I am the fracture liaison clinician and coordinator for a large academic tertiary care center in North Carolina. I'm also the CEO of RPJFLS, which stands for Right People Joining Together in Fracture Liaison Services. So
Hi, folks. My name is Dudley Phipps. I'm a PA at a large private orthopedic practice in Iowa. I'm the Chief Operating Officer of RPJFLS.
So you mentioned that we want to improve the value of care that we're giving our patients, and improving the value means making the right diagnosis and putting them on the right treatment and monitoring them. And we know that with osteoporosis, it's not just simply low bone mineral density, but it also has to do with the microarchitectural deterioration of the bone tissue. But we have no direct measurement of that. We haven't unless we've done bone biopsies, and we're not having people standing in line to get those done. We talked about that the other day, right? So what do we have available? Well, we have this wonderful software called Trabecular Bone Score. It is bone mineral density software program that estimates the bone texture information from the PA of the spine on the DEXA. It's a unitless measurement, so it's not a physical measurement, but it gives a comparison pixel by pixel photon X-ray absorption from the actual DEXA scan. The beautiful part of the TBS is that it's being used worldwide, and it actually provides information about fracture risk additive to your bone mineral density and your clinical risk factors.
Whenever we're looking at anybody that comes in through a fracture liaison service, ultimately what we're looking at is not a diagnosis of osteoporosis, but ultimately what is their fracture risk? And we need to know what their bone strength is. So bone strength is a combination of quantity of bone, as seen on a bone mineral density test, as well as the quality of bone. And the TBS allows us to get a better handle on quality measures and then incorporate them into a validated fracture calculator such as the FRAX.
So what the trabecular bone score gives us is an additional tool that we can actually put into the FRAX score, which will reconvert what their risk factors are. So in essence, TBS can be utilized to adjust for the FRAX. So the higher the TBS, the FRAX actually goes down. So their fracture risk goes down if their trabecular bone score is higher. But if their TBS score is low, then their fracture risk goes up. So in a patient that you're only using a BMD measurement on and you're doing their FRAX, you may actually miss somebody that actually needs treatment. But if you have that TBS additional technology and you have that conversion in there, you can actually identify patients more astutely that would be at risk and would be otherwise missed without that technology.
Well, there's a number of secondary causes, Clayton, that actually impact the quality of the bone. Items such as renal disease, diabetes, glucocorticoid treatment, aromatase inhibitor treatment, these all affect the microarchitecture of the bone. And again, some of these patients may have a rather normal looking BMD, but their microarchitecture, whenever you can pull that out separately and use it as a separate indicator of risk, gives you a much more clear picture of what their actual risk is. TBS is a post image capture software. So it does not change the capture time for the text. This is all post-processing software. So all they
Okay.
have to do is remember to run the TBS report.
We know that clinically, sometimes it's hard to convince patients, right, to go on treatment if their bone density is not that bad, yet they've had a fracture. So one of the benefits is with your osteopenic patients, the combination of TBS and BMD will result in a reclassification of really about 30% of those patients that would have been otherwise classified as osteopenic. But if you have that TBS, then you have that other predictor, and so it's complementary. So it gives that greater, if you will, push and confirmation to the patient. Really, for me, I guess the take-home message is anything that I can do to help my patients have a better understanding of what their bone strength looks like, what the quality of their bone looks like in conjunction with their bone mineral density. That is very convincing to them, especially if they've been in the position of a fracture. It helps them have a better understanding how the medications work. It can help enhance compliance with patients and convincing them with that additional additional bone parameter and encourages them to stay compliant, take their long-term prescriptions, have the follow-ups appropriately, but really with the ultimate goal of improving their outcomes, improved value of care, and helping them remain as active and independent as they can without a fracture in their future.
From a clinician standpoint, if I have somebody with a low energy or a fragility fracture and they come back with a BMD that's in the low bone mass range, the insurance company may not authorize the most appropriate treatment. And trabecular bone scoring gives us additional information to provide a more accurate picture of their fracture risk based on fracts, which the insurance company understands also.